In the great debate about third-class medical reform, one logical question might be, what do physicians think, or particularly, what do flying physicians think about the idea of third-class medical reform? And well, to answer that question, we have Dr. Richard Sloan joining us on AOPA Live this week. And Dr. Sloan is the president of the Flying Physicians Association, an organization that represents, well, physicians who fly, many of whom are also aviation medical examiners. And Dr. Sloan, you're yourself a senior aviation medical examiner. Thanks for joining us.
Yes, you're welcome. It's a pleasure to be here.
And so your organization is actually sending a letter to the Secretary of Transportation and the Office of Management and Budget in support of third-class medical reform. Tell us what that letter is about.
Well, this is a letter that came about after a survey we did of our members earlier this year, where we were trying to get their input as to what they thought about taking a look at the medical certification process and trying to create something that is less complex for private pilots whose complexity of flying may be well below the level of certainly an airline pilot or a commercial pilot. We do realize that we have done this successfully with the sport pilot certification. And we believe that we should look into this process further and that it kind of fits in with kind of the overall paradigm of medicine that we're currently practicing in.
So what is it that the survey showed?
Well, the survey showed that 80% of our members surveyed favored looking into this and looking at doing away with the current medical certification process, the third-class medical, for some private pilots.
Right. So, and what is it that you believe will be different if that passes? What will occur?
Well, I think that we still would favor some kind of self-assessment and educational process for private pilots so that they're aware of the kind of things that they should do to be safe medically when they're flying. We have mnemonics that we promote, like I am safe. We think that there could be online courses basically for private pilots warning them about medications that they might take, over-the-counter drugs or natural products or weight loss aids or things like that, and to try to promote to them things that they might do that could keep them flying safely. And we also want to promote a good relationship between them and their physicians that they see in an ongoing way to discuss honestly some of these issues without fear of bringing up some subject thinking that it would result in them not being certified.
Right. Now, as a family practitioner, you and an AME, you have some patients, I presume, who are pilots, and they want to come to you maybe as a family physician as opposed to their AME in some situations. How does that work?
Well, that is happening more and more in the current situation. I think many private pilots realize that with the sports flying certification, using your driver's license, that if your FAA certificate, your third-class certificate, is denied, that you essentially are not eligible for that kind of certification.
Right.
So many private pilots are sort of wondering, if I do have a condition and I bring it up to the AME, and my certificate is denied, then it knocks me out of flying even a light sport aircraft. And I don't want that to happen, so therefore I'm going to go talk to an AME or someone I can trust and find out what is my best option given my age and the type of flying that I'm doing, what would keep me flying longer. So we see that happening more and more often now.
Now, some of your members, obviously, are AMEs, yes, some of whom make some portion of their living off of third-class medical exams. Do you see any conflict there, and what is it that those folks have to say about this issue?
I think the bottom line for many of our members, part of what our organization is all about is really promoting education and safety. I think if our members felt that the outcomes of this would be good, would be positive, that, thinking about, yes, I do some FAA medicals, but a lot of our members do not make their living off of doing that.
Right.
And part of their income certainly comes from that, and part of their income comes from other activities as well. I think that could be a factor, but I don't really think that it's a major factor for for many of them. Certainly for me, only part of what I do is doing FAA medical exams. I'm involved in many other things as well.
Mm-hmm. What would success look like? A couple years down the road, aviation third-class medical reform passes. We have some reform. What would the future look like, do you think, for pilots and from a safety standpoint too?
Well, I think that for some private pilots that are not involved in highly complex sort of flying, that they could basically fly without the third-class medical that they're getting now. Mm-hmm. However, we would envision that some things would continue to occur. In other words, there should be some educational programs for pilots that teach them what they need to do before they fly each time. How can they stay healthy? What can we do to promote their health? I also think that there's going to have to be some way that we can figure out and cross-check pilots who are flying with what their driver's records are and be able to sort of pick up on people that might have demonstrated problems and behaviors with alcohol or drugs of abuse and things like that.
Okay. Well, complex issue and lots more to be done, but it's great having the support of a lot of flying physicians. So thank you for sending the letter on behalf of pilots everywhere.
You're welcome.
Thanks for joining us, Dr. Sloan.
You're welcome.